Hi, today I'll walk you through on how to drain an indwelling pleural catheter IPC using this type of drainage bottle. Let us go through the various parts of the catheter. This is the site where the catheter is inserted, and there may be stitches in place for newly inserted catheter. Most patients with catheters in place for longer than 2 weeks will have their stitches removed. This is the catheter or tube. This is the catheter valve with the valve cap. I want to remind you that the skin at the insertion site may be infected or bacteria can enter the chest through the catheter. It is very important to keep the dressing at the insertion site clean. Let's go through the steps on how to drain fluid using this type of drainage bottle. The vacuum in the bottle provides suction for drainage of the fluid. Remember that it's important to practice good hand hygiene before and after handling the catheter. Prepare your own waste bag. Open it up and place it on a chair next to you. Clean your hands with soap and water or hand sanitizer. Do not touch any non-sterile areas like your hair, face, phone or clothes after cleaning your hands. Gently remove the existing dressing. For the foam dressing, remove the transparent dressing. Uncoil the catheter. Then, remove the foam dressing. For the gauze dressing, remove the transparent dressing. Uncoil the catheter. Then, remove the gauze dressing. Examine the skin around the insertion site to check for redness, swelling, pus or blood discharge, loose or broken stitches. Also, make sure that the cuff is not visible outside of your body. Clean the tabletop with a disinfectant wipe. Clean your hands thoroughly. Open the drainage kit and you will see the procedure pack and the bottle with drainage line. Open the procedure pack by peeling the pouch apart. Carefully pull out the blue bundle while keeping the transparent dressing within the pack. Place the blue bundle on the tabletop with the folder side facing up. The blue wrap serves as a clean sterile surface for you to place the contents of the pack. Carefully unfold the blue wrap by pulling only at the edges to create a sterile film. Make sure the contents remain within the blue wrap. Prepare 2 additional pieces of alcohol swabs. Open them up and place them at the corner of the blue wrap. Clean your hands thoroughly and put on the sterile gloves by touching the cuffs only. It is important that your bare hands do not touch the areas of the gloves, which will later be used to touch the sterile items. After wearing the gloves, don't touch any non-sterile areas like your hair, face, clothes or phone. Sometimes the valve cap is placed within the gloves. If this is the case, be careful when you are picking up the gloves to wear them. Make sure the valve cap is dropped right back onto the blue wrap when you pick up the gloves, and do not touch the valve cap with your bare hands. Separate and lay out the items in the blue wrap. You should have 1 valve cap, 1 blue clamp, 3 alcohol swabs, 1 foam dressing, 4 gauzes, 1 transparent dressing, and 1 pair of gloves which you are already wearing. The blue clamp is for emergency use when the catheter is accidentally cut or damaged. Raise the inner part of the drainage kit to open it up to take out the bottle and place it on the blue wrap. Holding on to the drainage line and access tip so that they do not touch the non-sterile tabletop. Remove the tape from the drainage line. Carefully place the covered access tip on the blue wrap. If the cover falls off from the access tip, you can still use, but do not touch it with your bare hands or anything non-sterile. Close the roller clamp completely by rolling the wheel towards the bottle. This is to maintain the vacuum in the bottle when you are not draining the fluid. Gently remove the cover from the access tip and place the exposed tip back in the middle of the blue wrap. Remove the valve cap and throw it into the waste bag. Clean around the opening of the exposed catheter valve with a new alcohol swab, but don't try to clean the inside of the catheter valve, as this could damage the valve and allow air to enter or fluid to leak. Gently insert the access tip into the catheter valve until you hear or feel a click which means they are securely connected. This is important because if the access tip and catheter valve are not securely connected, they may accidentally separate during drainage and become contaminated. If this happens, clean the catheter valve with a new alcohol swab and use a new bottle to avoid contamination. Remember not to tug or pull the drainage line. Hold on to the bottle with one hand and remove the support clip from the top of the bottle with the other hand. Use your index and middle fingers or your two thumbs to hold the T-plunger and push it downwards to puncture the foil seal. To begin draining, roll the wheel away from the bottle to open the roller clamp. While the draining is happening, it is normal to feel some mild discomfort or pain. You can manage the pain in two ways. 1. Slow down the draining by rolling the wheel on the roller clamp slightly towards the bottle. 2. Stop the draining completely by rolling the wheel towards the bottle right to the end. You can continue with the draining after you feel more comfortable. Monitor the fluid volume by checking the scale on the bottle to make sure you do not drain more than 1000 milliliters of fluid a day. Some of you may drain less than 1000 milliliters of fluid each time. The flow of fluid into the bottle may slow down when the fluid is almost completely drained. When the flow stops or the bottle is filled, completely close the roller clamp by rolling the wheel towards the bottle right to the end. After you have finished draining, pull the access tip to remove it from the catheter valve. Clean around the opening of the exposed catheter valve with a new alcohol swab gently and thoroughly. Cover the exposed catheter valve with the new valve cap, twisting it until it clicks into a locked position. Tear open the 3 packets of alcohol swabs and place them in the middle of the blue wrap. Remove the backing paper from the transparent dressing and place it on the blue wrap with the sticky side facing up. Gently clean the skin around the insertion side with a new alcohol swab. Do so in the circular manner. Use a new alcohol swab to clean the skin further away from the insertion site. Gently clean the length of the catheter in a downward direction using a new alcohol swab. Do not try to pull or tug the catheter. Place the new foam dressing at the insertion site. Coil the catheter on top of the foam dressing. Place the gauzes over the coil catheter. Apply the transparent dressing over the gauze. Remove the center panel of the backing paper. Slowly remove the frame from the backing while pressing down the edges to ensure that they stick nicely to the body. Record the amount and characteristics of the drain fluid. You will need to dispose the drain fluid and use the bottle properly. To release any vacuum left in the bottle, open the roller clamp by rolling the wheel away from the bottle, then close it by rolling the wheel towards the bottle right to the end. Next, take out the bottle opener and cap from the bottle. Then, remove the bottle opener from the drainage line by squeezing the flexible cap. Press the pointed end of the bottle opener into the foil seal and rotate the bottle to create a bigger opening in the seal. Carefully pour the fluid into the toilet bowl and flush it. Finally, place the empty bottle in the plastic bag, seal it tightly, and discard it in the rubbish bin. Take note, this used bottle cannot be recycled. With practice, this will get easier. Remember to follow the steps and wash your hands before and after handling the catheter. Thanks and bye!